So what are the symptoms or signs of HIV? Because I know many people are afraid of going for a test. Maybe we'll start from DG.
Yeah, let me start with the last question regarding testing. Innovations now, we have what we refer to as self-test kits. Some use the blood, which is just a finger prick, like when you do your sugar level, and some even use saliva. You use you have the test kits, you just use it to swap your mouth and then put it in the serum, and then it gives you the test in about 15 to 20 minutes. So you can do this test in the comfort of your homes. What they are referred to as screening test. You have to, if it's found positive, then the individual has to go to the hospital for confirmatory test. And if that is positive, the individual is cancelled, explained to, and then they are put on medications, which are very potent. So I will start with that. So I encourage all our youths to get tested. You can buy the test kits, in any big pharma, and then you can go to our hospitals, to any government hospitals. You can do the test free of charge. We have over 40,000 facilities where these tests have been done, and aside from that, we do community outreaches occasionally, especially in the interland, to make sure that people get tested. Be that as it may.
What about the signs?
The signs and symptoms. Well, I wouldn't say there's a particular sign, and I wouldn't even want you to wait until you start seeing signs. Because by the time you start seeing signs, then that is advanced HIV. So I would say in this regard, prevention is better than cure. Okay. And I think the message is prevention, prevention, prevention. So even in terms of people want to spread the disease, what do we do? If you are protected, if you are preventing yourself, if you are having a safe sex, life, you are using condoms when you have to, you are being faithful to your partner, then you won't, you don't get HIV by sharing an office with somebody. You don't get HIV from using the same toilet. You don't get HIV from using the same cups,
from touching,
or even hugging. Yes, but you do get it from sharing sharp objects, either razor or injections or things like that, or syringes and all that. So once you know all that, and then you get protected, even if the person wants to give it to you, when you are not sharing sharp objects, you are not, being exposed sexually, and you are not blood transfusions and things like that, then there's no way the person can actually give it to you. So I'm just trying to say that, emphasize the message of prevention, prevention, prevention.
All right. Okay.